Let's learn about isolation precautions. So we've seen about the standard precaution, transmission based precautions. Let's see about personal protective equipment. To start with, let's see about gloves. Gloves purpose is for patient care, environmental services, and others. Gloves can be of vinyl material, latex, nitrile, and other materials. It can be sterile or non-sterile, and single use or the do and don'ts of the gloves includes work from clean to dirty and limit the opportunities for touch contamination. Protect yourself, others, and the environment, and don't touch your face or adjust the PPE with contaminated gloves. Don't touch the environmental surfaces except as necessary during the patient care. Change the gloves during use if torn and when heavily soiled, and after use on each patient. Discard in the appropriate bio-waste bin. Never wash or reuse the disposable. Regarding gowns, the purpose is to it can be natural or man-made, it can be reusable or disposable, and resistance to fluid penetration, and it can be clean or sterile. Face mask protects the nose and mouth. It should fully cover the nose and mouth and prevent fluid penetrations. Goggles protect the eyes, which should fit snugly over and around the eyes. Personal glasses not a substitute for goggles. Anti-fog features improves the clarity. Face shields protect the face, nose, mouth, and eyes. It should cover forehead, extend to below the chin, and wrap around the side of. Respiratory protection protects from the inhalation of infectious aerosols like microbial and tuberculosis. It includes particulate respirators or half or full phase elastomeric respirators, or powered air purifying respirators. Elements of respiratory protection program include medical evaluation, fit testing, training, and fit checking before. How to safely don and use and remove should be the CDC guidelines. The key points about the PPE includes don't before contact with the patients, generally before entering the room. Use carefully, don't spread contamination. Remove and discard carefully either at the doorway or immediately outside the patient room. Remove respirator outside the room. Immediately perform. The sequence for donning PPE include gown, mask, goggle, gloves. And the combination of PPE will affect the sequence. How to don? Select appropriate type and size. Opening is in the back of the gown. Secure at the neck and waist. If gown is too small, use two gowns. Gown one ties in the front, gown two ties in the back. How to don a mask? Place over the nose, mouth, and chin. Fit flexibly, nose piece over nose bridge. Secure on the head with ties or elastic. Adjust to a respirator. Select a fit tested respirator. Place over the nose, mouth, and chin. Fit flexible nose piece over the nose bridge. Secure on the head with elastic. Adjust to fit and perform fit check. Inhale, respirator should collapse. Exhale, check for leakage around the face. How to do an eye and face protection? Position the goggles over the eyes and secure the head using the earpieces or headband. Position face shield over the face and secure on brow with headband. Adjust to fit. How to do gloves? Don the gloves last. Set the correct type and size and insert hands into the gloves. Exchange gloves over isolation gown. How to safely use the PPE? Keep gloved hand away from the face. Avoid touching or adjusting other PPE. Remove gloves if they become torn. Perform hand hygiene before donning new gloves. Limit surfaces and items touched. Now let's enter the contaminated and clean areas of PPE. Contaminated include outside front, that is areas of PPE that have or are likely to have been in contact with body sites, materials or environmental surfaces where the infectious organism may reside. Clean inside, outside back, ties on the head and back. The clean surface include the inside and outside back, ties on the head and back. Areas of PPE that are not likely to have been in contact with the infectious organisms are included in the clean. Let us about the clean and contaminated sides of gown. Let's understand the sequence for removing, that is doffing the PPE. Gloves, face shield or goggles, gown, mask or respirator. How where to remove? It is at the doorway before leaving the patient room or in the anteroom. Remove the respirator outside the room after the door has been closed. Ensure that hand hygiene facilities are available and the patient needed. Sink or alcohol-based hand rubs are. How to remove the gloves? Grasp outside the edge near the wrist. Peel away from the head, turning glove inside out and hold in opposite glove. Slide ungloved finger under the wrist of the remaining glove. Peel off from the inside, creating a bag for both gloves and discard. Grasp the ear or head pieces with ungloved hands and lift away from the face. Place in designated receptacle for the goggles. Remove the gown. This involves unfastening the ties. Peel gown away from the neck and shoulder. Turn contaminated outside towards the inside. Fold or roll into the bundle and discard. Removing the mask. This involves untying the bottom, then top, tie. Remove from the face and discard. Remove a particular respirator. This involves lift the bottom elastic over other over your head first, then lift the top elastic and then regarding hand hygiene, it should be done immediately after removing the PPE. If hands are visibly contaminated, then wash the hands with soap and water and ensure that the hand hygiene facilities are available at the point of need. Standard precaution previously was called as universal precautions. It assumes that the blood and body fluid of any patient should be infectious, could be infectious. So recommends PPE and other infection control practices to prevent transmission in any healthcare settings. So the correct term would be now standard precautions. And the PPE for standard precautions includes gloves, gown, and goggles. What type of PPE would you wear depends upon the procedures, like drawing a blood from vein involves gloves, cleaning an patient with diarrhea involves gloves, without gown, irrigating wound involves gown, gloves, mask, or face shield, taking vital signs generally involves none. So that it depends. PPE for the expanded precautions includes contact droplet airborne, contact precaution gown and gloves, droplet is a mask, airborne in the particular respirator. Now, hand hygiene should be is required for all the standard and expanded or transmission based precautions should be done at the 5 PPE should be available to protect from the infectious materials. That's all. Thanks for the reference.